everybody, I am Thatnursingprof and welcome to my channel. In today's video we're going to be talking all about hallucinations. So let's get into it. So first let's define what a hallucination is. It is a sensory perception, so not just visual, right? This can be any of our senses that we're perceiving this, that occurs without actual external stimulus. So, for example, if I'm talking and you hear me talking, that's external stimulus, right? You are being receptive to my voice. If it is silent and you're hearing my voice, so no external stimulus is causing that sensation and you are still perceiving it, that is a hallucination. Hallucinations occur at the same time as real perceptions. And there's lots of different things that can cause hallucinations. So sensory deprivation. If you think about, sometimes our patients will have sensory deprivation, either from a sensory deficit like hearing loss or vision loss. Maybe they're in like an isolation room, so they're not getting a lot of meaningful stimulus. They're not getting a lot of people around them. So being in an isolated environment for a long period of time can cause sensory deprivation, which can cause hallucinations. Withdrawal from substances like drugs or alcohol. Brain damage, brain cancer is another one. Sleep deprivation, so people who go for long periods of time without getting rest can have hallucinations. So you might think of our insomniacs, people with insomnia. Or if you think about bipolar patients, when they have those manic episodes, sometimes those can last for days. They can last a long time. So they're going without resting. That can be very dangerous for them, and they can start having hallucinations. Fever, maybe you've heard of somebody having a fever dream. So when you have a high fever, it can cause hallucinations. This is more common in children and the elderly, but can happen to anybody of any age. Liver or kidney failure, prolonged stress, and then of course, hallucinogenic drugs. So this could be illegal drugs or prescription medications that can cause hallucinogenic effects. Since hallucinations are sensory perceptions, they can involve any of our 5 senses. They can occur singularly, so just with one, or with a combination of them. So just to review, auditory hallucinations would involve hearing sounds or hearing voices. These can be particularly dangerous, especially when they are commands. So they can be commands to hurt yourself or to hurt others. Olfactory would be smelling something that isn't there. Visual, seeing people or objects that aren't there. Tactile is feeling something. So an example of a tactile hallucination would be like feeling bugs crawling all over your body. And sometimes they can be combined. So maybe you can see these bugs and you can feel the bugs. So you're having both types of hallucinations. And then gustatory is tasting something. So you have a taste for something like metal, like there's metal in my mouth, or something dangerous. This can be very confusing because depending on what you're tasting, it could signal other medical conditions. So we need to figure out, okay, is this, a physiological problem or a psychological problem when they have these altered sense of taste? And little tip here, patients with psychotic disorders or anxiety disorders are more likely to experience visual and auditory hallucinations, while those who are using substances are more likely to experience tactile hallucinations. Some nursing interventions to use when caring for patients experiencing hallucinations. First, we want to ask about the hallucination. Ask them for details. Describe it. Important when you ask these direct questions about it, that it doesn't seem like you're going along with it. Okay? So you don't play along with the hallucination. Another thing you don't do, you don't fight them. You don't say, well, that's not really happening, right? So you don't want to argue with them about it, but you also don't want to play along with it. You just want to gather some more information about what they're experiencing. So asking direct questions can help with that. You want to develop a trusting relationship. You want them to trust you, and you want to provide empathetic care. As you can imagine, this is probably really scary thing for our patients to go through, right? So we want them to know that they're safe, right? Making sure the environment is safe, establishing that good, trusting nurse-patient relationship, and then providing empathy for them. Sometimes medications are going to be involved, right? So administering those medications as prescribed, and then if they're on medications, maybe the hallucinations are occurring because of the medications or because they stopped taking them. So asking them about their compliance with their medication regimen, because that could be the cause. You want them to interact with others, right? So socialization, group activities, that's going to help decrease these hallucinations. Instruct them to interact with those hallucinations. So when you're having the hallucination, you might recognize that it is a hallucination. You might realize like, hey, this isn't real, right? But what can you do about it? It can be helpful to give them a little bit of control over this situation, right? So when you recognize that you're seeing something that isn't really there, or you're hearing voices that aren't really there, you want to tell them, stop, go away. Right? And I know that sounds a little like silly, but it is actually really helpful for these patients to have a sense of control over these disturbances. And then a final nursing intervention, which a lot of people find helpful, is something called milieu therapy. So this is when the patient goes to a facility and they can practice like life skills and they can talk to therapists, and there'll be other patients like them that they can interact with, and they can go to group activities and sessions, and it's kind of just to promote independence and autonomy so that they feel like they have control over what's happening to them. And when they, graduate from it, then they can go back out into the world and be a normal part of society, and they can feel safe and comfortable doing so. So this can be something that's really helpful to these patients as well. And that's my video. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.